third section of the client information display is the medical history area. Just below this area is medical history view tabs, which allow you to view the patient's medical history sorted in different ways. The general purpose for the medical history tabs is for quickly viewing specific treatments or items that have been performed for a patient without having to scroll through the entire patient's medical history. These tabs will be displayed in bolded print if history exists in the highlighted medical history tab. The medical history view tabs are not restricted to the order in which they are displayed. All of the view tabs can be organized into the order that is most convenient for you in your practice. Each tab can be highlighted, then dragged and dropped to customize their placement. The tabs will maintain their function of defaulting to the chronological tab when a patient is opened, regardless of the placement of the chronological tab. To return the tabs to the original default order, right-click on the AVImark icon in the top left corner and select Default Layout. The chronological tab displays all medical history sorted by date performed. Click on the Diagnosis tab to quickly view all the diagnoses for this patient. Please notice that diagnoses appear in red. The Diet tab displays dispensed items that have been previously assigned a Z action code or whose category name includes the word diet. To view injections administered to this patient, click on the Injections tab. When selected, it displays administered items that have the word inject as part of their category name, or those items having a V or M action code or I report code. The next tab of Lab will show treatments performed that contain the word laboratory as part of the category name, or have an L as one of the report codes. The RX tab displays items or treatments for the patient that have the letters Pharm or Prescript as part of the category name, or they can even have a P action code or P report code. The Reminder tab will list all remindable services performed for this patient. To view a list of surgeries this patient has had, select the Surgery tab. Only those performed services that have the letters Surger in the category name or have the S as one of the report codes will be displayed under this tab. To quickly view vaccinations administered to this patient, click on the Vax tab. Only administered vaccinations that have a V action code or whose category name includes vaccination will be displayed here. The X-ray tab will display any performed treatments that have the letters X-ray or radio within the category name. Selecting SOAP allows you to view services for which medical condition data has been recorded. Under the Photos tab, AVImark will display services for which a photograph has been linked to a treatment, item, or diagnosis. To view the remaining tabs, click on the arrow located next to the Photos tab. By clicking on the Notes tab, you will see services that have notes attached. The next tab listed is the Public tab. The Public tab displays services that have been marked as public. This public field is located in the Enter Medical History window. The Problems tab will list all problems that have been entered into a selected patient's medical history. Please note that problems display in green. The Attachment tab shows all medical history entries containing file attachments. The tab named Dental views all medical history entries which have dental charts attached. Use the Requisitions tab to view medical history entries with lab requisitions attached. The last tab of Radiographs allow you to view history entries with radiograph requisitions attached to them. Another quick way of finding a specific treatment or item is to click in the description field located directly above the top entry line. In this field, you can begin entering the description of the treatment or item you're searching for. To the right of the medical history area is the Attachments area. You must first highlight an entry before being able to see what is attached to the entry. When an entry is selected, All attachments that are linked to the entry will have a red check mark in the corresponding checkbox to the left of the attachment option. The dental chart attachment will be checked if a dental chart has been attached to the selected medical history entry. If the form attachment option is checked, the selected medical history entry has a form attached to it. If the inventory used attachment box is checked, the selected medical history entry has at least one inventory item that was used during the administration. If the medical condition attachment checkbox is checked, the selected medical history entry has a medical condition record window attached to it. If the More Stuff attachment box is checked, the selected medical history entry has at least one additional data field of information that has been attached to it using More Stuff. If the Notes attachment checkbox is checked, the selected medical history entry has a note attached to it. If a photo is attached to the selected medical history entry, the photograph attachment will be checked. If the Attachments checkbox is checked, the selected medical history entry has at least one attachment linked to it. The Vaccination attachment option indicates that the selected medical history entry has specific vaccination information linked to it. The Tests box will indicate if the selected history entry has a laboratory test linked to it, and the last option of Radiographs will show if there is a digital radiograph attached. This concludes the tutorial on the medical history overview.